Life is changing in Australia as it is changing all around the world. Together, we are of course up to this challenge. All Australians. Mums, dads, kids, grandparents. We just need to continue to keep our heads focusing on the right information, making good decisions, helping and supporting each other. We are looking at a situation of at least 6 months. We are taking action across a broad range of issues. The first of those is the health response. We are also dealing very seriously with the very significant economic impacts to ensure the continued support of telecommunications and essential services and energy and fuel supplies and all of these issues. And thirdly, in workforce management. Wherever possible, we need to keep Australians working in ensuring Australia can keep functioning and importantly keep delivering the important services that are necessary for most people. Those of us who are blessed with good health and are in good condition, then this is a mild condition. If we slow the spread, then we do save lives. A human biosecurity emergency was declared under the Biosecurity Act by the Governor-General, and that regards the recognition of the threat, the coronavirus, and the need for the federal government to take actions under the Health Minister and myself as Prime Minister in relation to limiting that spread. Secondly, we are upgrading the travel ban on Australians to level 4 for the entire world. The travel advice to every Australian is do not travel abroad. Do not go overseas. That is a very clear instruction. For those of you who are thinking of going overseas in the school holidays, don't. Don't go overseas. Thirdly, yesterday, and you would have seen this announced last night, we put in place waivers of a series of aviation-related charges. They don't necessarily change the world for those airlines, but they do provide some support at a very difficult time. We have also made a decision yesterday to lift the restriction on work constraints on student nurses who are in Australia. Those 20,000 student nurses that we have in Australia, they're going to be available to help and support the health effort right across the country as directed by our health officials. And they've made the following decisions, and there'll be further decisions to come at the next meeting of the National Cabinet, which is on Friday. The decisions they have made are a ban on non-essential gatherings of persons 100 and greater in indoor areas. On outdoor areas, it's 500, and that is effective now. What is an essential gathering? So as to define what is a non-essential gathering. And that's an airport, public transportation, which includes public transportation facilities such as stations, platforms, stops, trains, trams, buses, etc. Medical and health service facilities, emergency service facilities, disability or aged care facilities, or I'll be coming to aged care and the constraints we're putting on aged care shortly. Correctional facilities, youth justice centres or other places of custody, courts or tribunals, parliaments, a food market, supermarket, grocery store, retail store, shopping centre that is necessary for the normal business of those premises, office buildings, factories, construction sites, mining sites, necessary for their normal operation. Now, particularly when we're talking about workplaces, I want to commend the employers of Australia, whether they're in the offices of our capital cities or elsewhere, who are already putting in place quite sensible rostering arrangements in their workplaces, as indeed public service employers are doing as well. It ensures social distancing practices are being followed in the workplace, but equally it is changing the strain and providing for greater social distancing on essential travel, particularly in public transport and things of that nature. It relates to schools, universities, education facilities and childcare facilities, hotels and motels and other accommodation facilities, which would include things like mining camps and other places where people are transiting, so in the Bourke Street Mall, Federation Square, Martin Place, those types of places. They are essential places where there are essential gatherings. Non-essential is everything else. States and territories have the ability to add to those lists as they see fit based on the advice, and that we're obviously seeking to coordinate that. Further measures on gatherings indoor of less than 100 people are being worked on by the states and territories in terms of their practical implication. The other issue that we need to follow is the principle of social distancing. Whatever gathering you're in, which is 1.5 metres apart, wherever that is practicable, to ensure that we can contain and limit the spread of the virus. On travel, the advice is that air travel, domestic air travel, is low risk. There are parts of this country that it would not be wise for people to visit. In remote Indigenous communities or remote parts of the country, and there are other parts of the country that are similarly sensitive. Now, we are working on a list of those areas that can be declared with the states and territories. There'll be further advice and there'll be further information on that will be provided in the days ahead as those issues are finalised. On public transport, I should say that remains essential travel, but social distancing should be sought to be practiced. The states are already putting in place proper hygiene processes in terms of cleaning of public transport. If you're getting in a cab or in an Uber, sit in the back seat, don't sit in the front seat. These are just sensible things that people should be following. The health advice is that schools should remain open. Now, there are a number of reasons for this. The first one is the virus operates very differently amongst younger people, and that presents a very different health challenge to the broader population. There's only one reason your kids shouldn't be going to school, and that is if they are unwell. Make sure if your child is unwell that you are taking action to keep your child out of school. That's your responsibility. Schools will obviously try and operate to their best ability to limit children who may come who are unwell, but let's not forget our responsibility as parents in this process. Whatever we do, we've got to do for at least 6 months. The disruption that would occur from the closure of schools around this country, make no mistake, would be severe. Tens of thousands of jobs could be lost, if not more. A 30% impact on the availability of health workers is our advice. That will put people's lives at risk. There is a national public interest here in keeping schools open, and our advice is that is not being done at the detriment of the health of any child. And if that became different, then premiers and chief ministers and I would certainly come to a different view. Now, aged care. The following visitors and staff, including visiting workers, will not be permitted to enter an aged care facility. Obviously, those who have returned from overseas in the last 14 days. Those who have been in contact with a confirmed case of COVID-19 in the last 14 days. Those with fever or symptoms or acute respiratory infection symptoms. Those who have not been vaccinated against influenza after the 1st of May. The facility must also implement the following measures for restricting visits and visitors to reduce the risk of transmission to residents. Limiting visits to a short duration. Limiting visits to a maximum of 2 visitors at one time per day. These may be immediate social supports, family members, close friends, or professional service or advocacy workers. Visits should be conducted in a resident's room, outdoors, or in a specific area designated by the facility, rather than communal areas where the risk of transmission to other residents is greater. There should be no large group visits or gatherings, including social activities or entertainment, to be permitted at this time. No school groups of any size should be allowed to visit aged care facilities. Visitors should also be encouraged, as all Australians are, to practice social distancing where possible, including maintaining the distance of 1.5 metres. Children aged 16 years or less should be visiting only by exception. Children can be asymptomatic. That's about protecting the residents. In cases of end of life, an aged care facility will have the discretion to put in very strict arrangements to enable people to visit their loved ones if that's the situation that resident finds themselves in. It needs to conform with the general principles around social distancing and the other measures that I've outlined. Anzac Day events or ceremonies should be cancelled due to the high proportion of older Australians who attend such events. But there will be a televised national event here in Canberra at the War Memorial. States and territories may also do one without public gatherings as well, and that will enable people to be able to join those services, at least remotely, on what is one of the most important days, if not the most important day of the year for Australians, as we honour those. Now, on bulk purchasing of supplies, stop hoarding. I can't be more blunt about it. Stop it. It's not sensible, it's not helpful, and I've got to say it's been one of the most disappointing things I've seen in Australian behaviour in response to this crisis. That is not who we are as a people. It is not necessary. It is not something that people should be doing. What it does is it is distracting attention and efforts that need to be going into other measures to be focusing on how we maintain supply chains into these shopping centres. There is no reason for people to be hoarding supplies in fear of a lockdown or anything like this. AHPPC advises against the bulk purchase of foods, medicines and other goods. We discourage the panic purchase of food and other supplies. I am seeking Australia's common sense cooperation with these very clear advisory positions. Stop doing it. It's ridiculous, it's un-Australian, and it must stop. And I would ask people to do the right thing by each other in getting a handle on these sorts of practices. Also, do not abuse staff. We're all in this together. People are doing their jobs. They're doing their best. Whether they're at a testing clinic this morning, whether they're in a shopping centre, whether they're at a bank, whether they're at a train station, everybody is doing their best. So let's just support each other in the work that they are doing. And I encourage you, please, if you see someone who's doing that, just call it out and ask them to just refrain from doing that. That's the right thing to do. The government is considering quite extensively further economic measures that will deal with the strength and the strengthening of our safety net and cushioning the even greater impact of the coronavirus on the Australian economy, particularly on small businesses and individuals. We are putting in place further measures and we will announce them once they've been properly designed and they can be properly implemented. On the health side of things, 80,000 tests have now been completed and we've been able to source additional supplies of testing kits, which is very welcome, and further supplies are being secured, and that includes having domestic solutions to the supply issues that relates to the testing equipment. The same is true for personal protective equipment. When it comes to medical supplies, when it comes to personal protective equipment, when it comes to testing, it's important to follow the rules around these. These are critical resources. They shouldn't be used where it's unnecessary to use them. There's a lot of misinformation out there. There's a lot of ridiculous stuff that's circulating on text messages and internets about lockdowns and all of this, and sadly there's even been cases of willful fraud and fraudulent preparation of documents, even recordings alleging to represent cabinet meetings and things of this nature. Don't believe it, it's rubbish. Go to health.gov.au, go to the relevant state health websites to get your information on what's happening. Avoid all that nonsense. The experts that the government is relying on, all of the state premiers and the chief ministers and myself are working with those experts, whether it's in supply chains, whether it's in workforce management, whether it's in health, whether it's in power or telecommunications. They're the people we're getting our information from. We'll continue to update you as regularly as is possible with clear decisions on what we're doing, but on the misinformation, just ignore it. I will give you the information as best we can and as regularly as we can.